It can make a singer go silent and keep a boy from growing tall. Stress. On Radiolab. Listen wherever you get podcasts.
In the United States, Black women are more than 3 times as likely as their white counterparts to die from pregnancy-related causes. And last month, a report published by the CDC showed that this disturbing maternal health crisis had gotten worse during the pandemic. Overall, maternal mortality rates rose 14% from 2019 to 2020. It's an increase attributable primarily to rates for Black and Hispanic women. Now, we should also note that while past CDC data did show that Indigenous women were more than twice as likely as white women to die from pregnancy-related causes, this latest round of CDC data doesn't include information on Indigenous communities at all. Now, some states are trying to find solutions to this crisis. For example, last year, Illinois became the first state to expand postpartum Medicaid coverage from 60 days after birth to a full year. But given that Black women have higher mortality risk, even at middle and high incomes, it's clear we need a far more complete overhaul of the American maternal health system.
My name is Monica McLemore, and I'm an associate professor in the Family Healthcare Nursing Department at the University of California, San Francisco.
Professor McLemore has been working on the issue of maternal and child health for decades and sounding the alarm about just how serious the situation is. I asked if she was surprised by the increase in pregnancy-related deaths for Black mothers during the pandemic.
No, and I bristle sometimes when people call me an oracle, but I will point the listeners to a piece I published on March 28th of 2020 in Scientific American, which was entitled "The Pandemic is No Reason to Abandon Pregnant People." And at the time I wrote that piece, I didn't realize how prescient it was going to be in terms of really predicting that Black pregnant capable people were going to bear the brunt of the harms from COVID-19. And I want to contextualize these statistics for the listeners, just so they get a real sense of how to think about them and how to interpret them. So these are counts, and we count the number of pregnancy-associated deaths by deaths per 100,000. And the reason that we do that is these are small numbers. And we've known that the maternal death rate in the United States has been rising for the last 4 to 5 years. So in 2016, for all maternal deaths, they were about 19 per 100,000. In 2019, it rose to 20 deaths per 100,000. And this is everybody. And in 2020, we just saw it's 24 deaths per 100,000. Now, this is 861 deaths. So the numbers are relatively small and rare, which is why we calculate them out to per 100,000. But when you think about it, the deaths for Black people were already 44 deaths per 100,000. So twice the number in 2019. And in 2020, there are 55 deaths per 100,000, as compare it to the 24 deaths per 100,000 for everyone. So the averages really hide these numbers. Black deaths from pregnancy-related causes in these statistics is now 3 times higher for Black people. That's why those numbers were so alarming.
As you were saying the numbers, the rates, I was thinking, wait a minute, that's not just a proportionate sort of everyone leveled up, right? Or in this case, leveled down in terms of, right? But that there was actually an exponential growth, relative growth in that gap.
Yes. And for white people, it stayed the same. So, that we went from double the number of deaths to triple the number of deaths during the pandemic should not be surprising to anyone, because it was predicted not just by me, but by a whole lot of other people. And these counts that come from the National Center for Health Statistics, they're just that. They don't pontificate or make any extension to the causes of these deaths. They're just counts. But what we already knew from other research and other triangulated data, that COVID-19 was going to be exacerbated in people who had chronic conditions like hypertension and diabetes. And we already know that Black people are overrepresented in those chronic conditions, not because they're Black, but because of structural racism, right? Because of inability to have access to wealth and capital and food and clean water and decent environment. So we already knew that chronic conditions were expected to exacerbate COVID-19. And Black people are overrepresented in chronic conditions because of structural racism, and particularly how that's operationalized in healthcare. And so it shouldn't be surprising to people that we saw a tripling of Black maternal deaths in 2020 associated with the COVID-19 pandemic.
Okay. Even if it was not a clear surprise, I suppose one of the things I feel like I noticed within the public sphere was greater conversation about it, greater awareness of it, even the fact that there was a White House symposium, addressing this, which I think was a first time, right, at that level of policymaking and acknowledgement of the racial gap in maternal health. Even as we were publicly acknowledging this thing that you and other researchers have known for quite some time, how is it that that gap grows and those numbers grow at the same time that there seems to finally be attention?
Well, okay, let's add even more attention, right? I mean, in 2020, we had a first ever presidential proclamation of the Declaration of Black Maternal Health Awareness Week, which is April 11th through April 18th, was started by the Black Mamas Matter Alliance, right? The vice president put forward a maternal morbidity and mortality crisis day and call to action. We had the Momnibus, which has been introduced. It was first introduced in 2020 and got pulled and died on the House floor because of the COVID-19 pandemic, introduced by the Black Maternal Caucus, led by Representative Oma Adams from North Carolina and Rep. Lauren Underwood from Chicago. And it was reintroduced January 3rd, right before the insurrection. It went from being 9 bills to protect maternal health across the spectrum to being 12 because they included maternal vaccinations and COVID-19. This comprehensive bill that would have done something about these increases in maternal deaths have been languishing in Congress because they got tied into the Build Back Better bill. So having dollars and humans and space and awareness is languishing because that legislation has not passed. So we actually know what to do to reduce maternal morbidity and mortality. We know what the strategies are. We knew these deaths were preventable in the same way we knew COVID-19 deaths were preventable if we appropriately married public health mitigation strategies along with clinical health services provision, right? But the other thing that these statistics don't reflect, and again, for the listeners, childbirth prior to COVID-19 was the number one reason why people in the United States were being admitted to healthcare and hospital institutions, because we have 4 million births, or approximately 4 million births a year in the United States. Number one reason.
Wait, slow down. Say that one again. That one I didn't know.
So prior to COVID-19, pregnancy and childbirth were the number one reasons why people in the United States were admitted to hospitals and healthcare institutions, because we have an estimated 4 million births per year. And only 2% of births happen outside of hospitals and healthcare institutions, like at birth centers or home births. So 98% of births in the United States happen in hospitals and healthcare institutions. And prior to COVID-19, it was the number one reason why people were admitted to hospitals and healthcare institutions.
So basically everybody in the hospital during not everyone, but just an overwhelming proportion during the pandemic are people giving birth or people with COVID-19?
Yes.
Or both?
Yes. So it has implications. I mean, and these are, again, the national health statistics were deaths, right? It says nothing about long COVID. It says nothing about having had COVID and recovered, right? I mean, we have pregnancy registries, including the ones, full disclosure, that I'm associated with at the University of California, San Francisco, where we've been tracking persons from the beginning of the pandemic who were pregnant at the time and had COVID. We were looking at numbers of deaths and numbers of morbidity and mortality, looking at symptomology. We found that preterm birth also increased. So it wasn't just maternal deaths. It's also all the other known factors that were associated with infectious disease during pregnancy that we've been monitoring for years. So yes, the statistics and counts are horrible in terms of what we saw from the report from the National Center for Health Statistics last week with the 861 deaths. But those counts are not even inclusive of the other negative sequelae that happen when you have infectious diseases and pregnancy together. It didn't even capture the increase in preterm birth. We reported on that in the Lancet, right? The 13% increase in preterm birth. So we really need to talk about these statistics in the context of not only were pregnant people not protected, similarly to, our flattening the curve on the backs of the essential workers, we didn't prioritize the right individuals to be able to receive those public health mitigation strategies and we didn't prioritize protecting pregnant, capable people.
Okay, two more of these numbers I want you to break down for us. One is how race intersects with age. As a Black woman well over 40, also, however, no longer pregnancy capable, but well over 40, when I look at that category, those numbers are absolutely astonishing. How is it that age intersects here?
Well, we call people who have pregnancies over 35 advanced maternal age.
Y'all call them geriatric. I remember because it was written on the file. Geriatric pregnancy, and I had many feelings about that, let me tell you.
That drives me up a tree. But the formal clinical term is advanced maternal age, and that is because epidemiologically, when we look at all the pregnancies that are reported in the United States, there are age groupings that occur where we look at, again, chronic disease, chronic illnesses, and other comorbidities that complicate pregnancies. And there was an arbitrary age that was determined based on population level statistics that over 35 was advanced maternal health. Prior to the pandemic, we already knew that people who were of advanced maternal age were already going to be more likely, again, to experience chronic conditions that complicate pregnancy. So when you look at the raw statistics of all maternal deaths and you look at them by age, it doesn't look as though they've increased. However, when you look by age and when you look by race, and this is another argument for the need for disaggregated statistics by race, by ethnicity, by age, by all of these different factors, so that we can really hone in on who has the greatest burden. And that's where you really see the people over age 40 bearing the brunt of COVID-19, chronic conditions, all colliding together in the context of pregnancy and resulting in increased mortality.
Let's talk about Hispanic and Latina people capable of birth and what happened with those numbers. And maybe also start by walking back, because I think sometimes we presume that Latinx health and Black health sort of are exactly next to each other, but that is often actually not the case. And it looks like there were some very particular effects that happened here.
Yeah. And there's been a lot of discussion and a lot of conversation just really quickly about the sort of Latina or Hispanic paradox, right? That more recent immigrants who come to the United States, we've seen this epidemiologically. Now, there definitely is regional variation in this, but for more recent immigrants who come to the United States, they seem to tend to have better health outcomes. And that the longer that they stay in the United States, their health outcomes deteriorate. And people have tried to attribute that to the adoption of the American diet or, cultural factors in terms of assimilation. And, I personally think they start to become as exposed to overt racism as the rest of us who've been here our whole lives. But that's a different discussion. In the data from the National Health Statistics, we saw that pregnancy-related deaths per 100,000 climbed in Black people, again, from 2019, from 44 to 55 among Black people. But it went from 13 to 18 among Hispanics. And the reason that matters is, interestingly enough, when you look at Hispanic individuals, their birth outcomes are actually better than anybody's if you break it out by nativity. Because the 2020 rates among whites were 19 deaths per 100,000. Hispanics went from 13 to 18. They're still under, in terms of death, they're still under white people in these statistics. Right? So it's a mixed picture in terms of who, and they were overrepresented in essential workers. Right. So it's this mixed bag, and it's hard to interpret without other kinds of research studies and registry data to be able to really tease out what's going on. The other piece of this is that within the age categories, because Hispanic people tend to have births earlier and younger, it really debunks this notion around the stigma that we've had around teen pregnancy. Because people are really starting to hypothesize that if you do have your children younger, you actually, well, not youngest, but younger, you actually may have superior health outcomes, both for you and baby, depending on where across that reproductive spectrum your pregnancies occur. So it's more complicated than we've always thought about in terms of, how we set up health services provision and how we do public health surveillance. This is why reproductive justice is just so important, and that we use that to really infuse our thinking around who is protected, who is vaccinated, who is able to really have the workplace protections that's necessary in order to have healthy pregnancies and to have healthy outcomes, and who's be able to access comprehensive reproductive health care during a global pandemic.
Can I ask you about a group that was simply left out from these statistics, and that is Indigenous women? And I looked, I was like, hey, I'm up in here, I don't see it. What is going on with that?
Well, so there have been many brilliant people, and epidemiologist Abigail Echo Hawk is really good at clearly articulating this way better than I can, that Native Indigenous people are traditionally and historically excluded because of what I think is a poor scientific excuse, that their numbers are too small to be reported. And it really has to do with the fact that because maternal deaths impact a community, and it's one of the reasons why statistically we report them out per 100,000, that we don't want people and their deaths to be disclosed because that's confidential information. And to me, I think that's a lazy statistic, especially being a laboratory scientist and knowing that we could account for small numbers. I mean, when we have genome projects, we will have an N of one, right? A sample size of one person, but we'll look at 1,000 genes, and we figured out statistical methods to be able to account for that. So I don't understand why we keep arguing that the numbers of Native Indigenous individuals, especially pregnant people, are too small for us to do any kind of analytics in terms of understanding just the basic counts. I actually think we need some new statistical methods to be able to make sure not only are they included in these data, but we also know that their deaths in pregnancy are an extreme undercount when we actually do have regional counts and not national ones. So I think that there are ways for us to think about pooling data, whether it's across, traditional tribal lands or reservations. There are ways for us to be able to do that. And Native scholars have been working on this, and we need to lift up their methods such that they can be included in these counts as well.
Dr. Monica McLemore is Associate Professor of Family Healthcare Nursing at the University of California, San Francisco, and always teaching me something new about methodology. Thank you, Monica.
Thank you for having me.
This week on The Experiment, Atlantic editor Dan Engber has spent months with rehab engineer James Sulzer.
I went into this to build devices to help people, but I never considered that building devices might not be the answer.
Now he tinkers away, trying to help his daughter Livy regain brain function.
It's really easy as a scientist to poo-poo everything and be skeptical. But as a parent, you need to have some optimism and you need to have leaps of faith.
Listen to The Experiment wherever you get podcasts.